In this section, we will talk about the ureter. So, the ureters are a pair of narrow, thick-walled muscular tubes, which convey urine from the kidneys to the urinary bladder. They lie deep to the peritoneum, closely applied to the posterior abdominal wall in the upper part, and to the lateral pelvic wall in the lower part. Now, let's discuss the dimensions of ureter. Each ureter is about 25 centimeters or 10 inches long, of which the upper half, or 5 inches, lies in the abdomen, and the lower half, or 5 inches, in the pelvis. It measures about 3 millimeters in diameter, but it is slightly constricted at 5 places, which will be discussed later. Moving forward, the ureter begins within the renal sinus as a funnel-shaped dilatation, called the renal pelvis. The pelvis issues from the hilus of the kidney, descends along its medial margin or partly behind it. Gradually, it narrows till the lower end of the kidney, where it becomes the ureter proper. The ureter passes downwards and slightly medially on the tips of transverse processes and of Psoas major muscle, and enters the pelvis by crossing in front of the termination of the common iliac artery. This is pelvic brim. In the lesser or true pelvis, the ureter at first runs downwards and slightly backwards and laterally following the anterior margin of the greater sciatic notch. Opposite the ischial spine, it turns forwards and medially to reach the base of the urinary bladder. This is common iliac artery. These are internal iliac artery and external iliac artery. This is prostate, and this is urethra. Now, let's discuss the normal constrictions of the ureter. The ureter is slightly constricted at 5 places. At the pelvi-ureteric junction, at the brim of the lesser pelvis, point of crossing of ureter by ductus deferens, or broad ligament of uterus, during its oblique passage through the bladder wall, and at its opening in lateral angle of trigon. Now let's discuss the relations. In the renal sinus, branches of renal vessels lie both in front and behind it. This is cortex. This is medulla with pyramids. This is pelvis of ureter. This is ureter. Now, moving forward, outside the kidney, anteriorly on the right side, there are the renal vessels and the second part of the duodenum. On the left side, there are the renal vessels, the pancreas, and the jejunum. Posteriorly, there are Psoas major muscle. Now, let's discuss the abdominal part of ureter. Anteriorly, on the right side, the ureter is related to third part of the duodenum, right colic vessels, ileocolic vessels, gonadal vessels, root of the mesentery, and terminal part of the ileum. On the left side, the ureter is related to gonadal artery, left colic vessels, and sigmoid mesocolon, while this is splenic vein. This is inferior mesenteric vein. This is left renal vein. This is inferior mesenteric artery. And this is gonadal vein. Now, let's discuss the histology of ureter. Ureter is composed of star-shaped lumen, transitional epithelium, lamina propria, inner longitudinal, smooth muscle, and outer circular, smooth muscle. Moving towards clinical anatomy. Ureteric colic is a term used for severe pain due to a ureteric stone or calculus, which causes spasm of the ureter. The pain starts in the loin and radiates down the groin, the scrotum, and the inner side of the thigh. So this was all about this section. In our next section, we will talk about the development of kidney and ureter.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.